Right, we're going to hyperlipidemia. So, hyperlipidemia, the first agents would be statins. That's a HMG CoA reductase inhibitors. They're working on to decrease triglycerides about 20 to 40 and HDL increase 5 to 10. So statins, they end with statin. Very easy to remember. Simvastatin, lovastatin, atorvastatin. With simvastatin, you have to remember do not initiate or do not increase to 80 milligrams per day. So statins are not for taking it with grapefruit, lots of interactions. Side effects is rhabdo, also myopathy. That's very, very common. Hepatic insufficiency, new onset diabetes, monitor lipid and LFTs, transaminase, total bilirubin, creatinine kinase if severe muscle pain. So with statins, again, they end with statins. With simvastatin, you do not initiate or increase to 80. They do triglyceride decrease 20, 40. HDL increase 5 to 10. And side effects, rhabdomyopathy, hepatic and issue, and a new onset diabetes. Next, we're going to go with non-statin, and that's cholesterol absorption inhibitor. They decrease by 13 to 20% LDL and increase HDL by 15. So the one that we need to know is ezetimibo, whatever, Zetia. Zetia must be taken with food and absolutely no pregnancy or lactation. Side effects, myalgia. Most of them are side effects, myalgia. Both non-statin and statins show cardiovascular benefits in combination. So again, non-statin, 13 to 20 decrease, and increase HDL 15%. Next, we're going to go and do PCSK9. They decreasing LDL by 60%, and I believe that that's the highest ones, and increase HDL just 5%. They also have CV cardiovascular benefits. So they end up with Qumab, alirocumab, evacuumab. So Qumab is a PCSK9. I'm thinking that I'm imagining a dog, like a canine dog, and his name is Qumab. That's the only way how I will remember. So the good thing about this is that's a sub-Q and giving every 2 weeks. Very expensive. Side effects is flu-like symptoms, injection site maybe, also myalgia, and that's it. PCSK9 Qumab inhibitors decrease 60, increase 5, cardiovascular benefits, myalgia, and end with Qumab. Next is going to be bile acid sequestrants. They usually begin with col or CHOL or COL, col. That's how I will remember them. They decrease by 15 to 30% LDL only. And they are given if statin or not statins not working. So these drugs approved for diabetic patient to decrease also A1C. Lots of interaction. It is huge pill. Interactions include warfarin, levothyroxine, thiazides, amiodarone, but they are not systemically absorbed. Okay, moving on to siRNA inhibitors. They are decreasing LDL by 50%, increase HDL by 10%. The name is inclisiran, Lequio. Yeah. Side effect is injection site, GI, constipation, also myalgia. You have to give 1 hour before meds. They have no interaction. So CRNA decreased by 50, increased by 10. Next is going to be, after everything worked, fibrates. Well, before I go to fibrates, let's talk about another one is bempedoic acid and zetia combo. So that is called Nexilet. Nexilet is decreasing LDL by 40%. The side effect is the uric acid increase, also myalgia, spasms, risk for tendon rupture, UTIs, constipation, and nasopharyngitis. Now, bempedoic acid alone, it's called Nexitol. So I'm thinking like I'm standing alone, tall, next to tall, and the combo is you stand next and like next to let. So I don't know, but anyway, side effect for bempedoic acid, which decreasing LDL by 20%. Side effects are uric acid as well. You avoid and cautious with gout. You don't give with gout. Side effects also myalgia, risk for tendon rupture, just like Nexilet. So again, bempedoic acid decreased by 20%. If it's with combo with Zetia, that's decreasing by 40%. Uric acid in both of them increase. So of course, don't be very cautious with gout and myalgia and risk for tendon rupture, muscle spasms. Next, fibrates. Finally. Okay, so fibrates are usually with statin or without. So with to give with statins, fenofibrate is preferred with statins to decrease myopathy. And you don't give with statins, that's called gemfibrate or gemfibrate. So without statin is gem, with is fen. So with gemfibrate, not with statin, side effects is LFTs increase, myopathy, photosensitivity, rash, and increase clearance. It is absolutely contraindicated with statins, the gemfibrate, and it is not for gallbladder issues. So fibrates, one of them is with statins, fenofibrate, and without statins, that's a gemfibrase, not for gallbladder and not with statins. Next, if nothing works, or you want to add some more icosapent ethyl or omega-3 and niacin. Adverse reactions are dyspepsia. It is ideal for liver patients, although it has a lot of interactions like Plavix, NSAIDs, SSRIs, antiplatelets. And side effect, of course, it's a bad taste or smell and risk for bleeding, like omega-3. So if your triglycerides more than 150, you need to consider fibrates. And if it's more than 500, you add. With hyperlipidemia, initial goal is to decrease LDL by 30 to 50% if had any ASCVD. Start high intensity statins. And number two is target LDL less than 70 for low risk people. Meds that increase LDLs are steroids, estrogen, protease inhibitors, atypical antipsychotics, beta blockers, immunosuppressants, and thiazide diuretics.